This is Senate Appropriations, Friday, January 26th, and we're continuing our discussion, on the BAA, which has been passed by the House. Some of what we've been having conversations about is sort of reminiscent of last year, where the BAA, as it got passed by the House, included new programs or new initiatives. They were beyond, technical truing up, or where assumptions came in either higher or lower. And so, we're gonna go through and kind of identify those that, and the reason, and we can talk about it, we had some discussion, but the more you advance spending in the BAA for new programs, you are basically making them the top priority for spending and funding over everything else that's gonna be in there, for consideration in the budget. And so last year, the House BAA included over $9 million for organic farmers. We pulled it out. It was a new program. We didn't think the money had been really thought through. It was done kind of very hurriedly. And in the end, we did appropriate the money, but it was in a lesser amount, but it was in the big bill and in the context of every other request that has been made. So obviously, there are organizations and programs that would like more money. And we're gonna see a number of those, actually reflected in the budget adjustment.
Did that this year?
Again, yeah, so, and it doesn't mean that they don't have merit, or it doesn't mean that you're making a decision. The question really for us is, by funding it, are we basically saying those expenditures or those funding requests are of higher priority than all the other ones that we're gonna be getting in the VA, or what is not included in the big bill? And we know that the governor's proposal includes level funding for a lot of community-based programs, including mental health, including youth services, a lot of the services for our seniors.
2 million out of adult days.
Right, and the House did not put anything in. Now, that was an assumption based on estimated utilization, and now we have waiting lists for our adult day programs. The House opted not to do anything in that area, but they did add funding in areas that would be new in terms of budgetary support. So I'm at one point, we're going to go through this kind of document, which is a side-by-side. What did the governor propose, and then how did the House spend the upgrade of 29 million? And you can see that there are a number of some very large expended, proposed spending. And so this is going to be our task, and that is, which ones do we really feel that we would want to include, or which
These are all one time?
all one time? And would we, because the 29 million, only about a third of it is ongoing. So 2/3 or about 20 million is one-time money. It's still sort of the tail of those higher state revenues that were generated by all the federal dollars coming through and people consumed, and we got higher taxes. So we're gonna, maybe not today, but we're gonna have to go through and say, we're not making a decision in terms of funding finally, but are these areas of spending that we would say need to be considered? Because the more money that we appropriate here, the more we constrain, and the more we put one request higher than another. And I don't think necessarily a lot of people think of it that way, but in essence, that's what you're doing, is saying this $670,000 request is more important than something else.
Just because it was in FY 24 doesn't mean it has to be spent.
No, these are new. These are new. These are all new. They're new.
Well, I know what I'm saying, but the money
Yeah. Oh,
will
yeah,
be here. in
yeah.
FY 24.
yeah, that's right. That 29 million upgrade doesn't go away. It just, and the fact, and our challenge is the governor has built that in terms of how he wants, is proposing to spend it. So, I know you can argue, well, if it was a reduction, we'd have to figure it out, but, so if it's an increase, then we ought to be able to spend it. My only point is this the point we want to spend it? Because it can be spent, in the budget, in the big bill, priority setting process. So, there are some things that, you know, we know that are very clearly new requests that came in, and obviously people are now using the budget adjustment process to make, requests to get money. And the cleaner we can make it, and the more we sort of keep our options open so that we can give every request, I mean, full consideration, against each other, then, the more, capacity we're giving ourselves as we build the big bill for, 25. So, I don't need to have you go through this today, but I would ask you to look. And it doesn't mean that, that any of these requests don't have merit. That's not the issue. The issue is, would you put them at the top of your priority list? Yes.
Or could there be another criteria, be timing?
Yeah.
Like,
Like the,
if you need to do it now, you can't wait till July.
yeah,
So,
but like the purchase of the,
The armory.
yes,
Right.
yes. And that ties into some of the housing, you know, funding certainly. And, I think also other things that come up, when you're building a budget, you're using estimates on caseload, on expenditures, on contracts. Sometimes they come in higher, sometimes they come in lower, but sometimes there's things that are totally unanticipated, like the flooding, for example. So, those are things that you do have to,
And
put in the
can
mix
someone
here.
separate out for us
What?
that, or having done it
It's in
already,
here.
and I didn't look
It's
at it?
here.
Folder.
Oh, thank
It's
you,
right here.
my goodness.
Yeah,
Andy gave you a
sections are right
it's
there.
right here.
And they gave me a folder. I-
Yes, Hannah's giving you a folder. And so what is in the folder is the cliff notes, on the House Pass BAA. Which we do when we pass, and it's a good way of seeing what's in here. And the other thing, is in here is, the money sheet, and this is really what I'm looking
Yeah,
at.
okay.
In terms of what the governor proposed, what the House added or, did not add, that we're gonna have to,
Okay,
deliberate.
thank you.
And the other, as we're building our agenda for next week, we've got to think about how, who we want to have come in, to offer more testimony. I would think the administration, we would want to offer an opportunity because I'm sure that they might, have, a position relative to some of these you know, some of the funding, that is included here. So, yes, Senator Sears.
Yeah, so this is the list here where the House agreed with the governor, where they didn't agree with the governor,
Yeah, where they put in more money, so.
or less,
Mhm.
like business transformation funding.
Yeah, which we took it, and we will have more discussion around that. But for example, we've had a request for a number of years. It came from United Way. It's in Lemoyle County. And we didn't fund it in the budget. Now, they came back and said, we'd like to have funding. That would be an expansion, a new program. I would say to me, this is only my view, that that's something that we should say needs to be considered when we do the big bill.
I wanna put the $29 million.
Mhm.
Is that real money or is that projected income?
No, that's based on the revenue of forecast upgrade.
And we just clarified that.
Yes, two days ago.
Yeah, so where this is not money in hand, but it is money from us.
Yeah, yet to be, well, some of it, we already know we're running ahead of forecast
Right.
year to date.
Some of it's in.
So some of it is in
But
hand.
you're spending every dime.
We're spending it before we know what else is out there that we may like to appropriate.
So I'll just throw out here, that whether we want to revisit, I don't know what our decision would be, but we know that the one that I think Senator Westman's referenced is the adult days. And they've got a waiting list and, they, based on utilization, they did a $2 million reduction.
They base their decisions based upon what the last 3 or 4 years has been, and who would take their elderly parent, to an adult day
When you say
during
they,
COVID.
you mean the administration?
No, if you were an individual
Family
person,
member.
a
No,
family-
when you say they made the estimate based on the past,
Yes.
So,
who is they?
Dale, agent of independent living. So they removed $2 million out of that. Now, the adult days function as very much a part of that long-term care,
Yes.
community service delivery that keeps people out of nursing homes.
and
So,
allows their, many times their kids to work.
Yeah,
to me, that's an example of where we need to have some discussion, but, and some things we, I think would, I don't mean to say we would disagree with all of them, but some, we might say, we're not making a decision now, we want to wait and, put them in the big bill next.
if I remember correctly, there was also some VA moving of ARPA funds,
There
but
was
they're not
five,
in here. Is this just general funds?
yes, this is general on
Are there-
education.
But there are some one-time ARPA funds.
There was
that
a
we would
$5
have-
million
Is it just-
recapture and redirect of ARPA for, flood relief for
Right, I
municipalities.
think there was others, but I didn't know if that was also, we would have a sheet on the one times that was, did that recapture.
We can, yeah.
There was only 2 items,
There's a,
when they did
The 5 million.
first 5 million to municipalities, and then 30 million to VHCB. Was the only ARPA reallocation they had. Now, this sort of falls into the same
yeah,
issue, is that the administration has also proposed ARPA reallocation, so we'll pull together sort of both for what's in you got what the House passed, what the governor recommended in the BAA. We need to add what the governor put in the 25 budget for the general fund, for all of the funds, and get you an updated sheet
Yeah.
with that, so you can have sort of all 3 pieces of that puzzle.
Well, we're gonna have to. We can't, this sheet here is not ARPA.
No. We'll make one with
So
ARPA.
I think that was the question.
Yes, sorry.
For the ARPA related that are in the BAA. There are some things that we might say we still wanna move ahead and we'll obligate the funding because of the nature of the purchase, of the expenditure. And so that there will be some things, and there are other things that maybe we would add that the House didn't have, but there might be many of the things that are here that we would say, we just wanna, consider them when we do the big bill.
so I just wanna, my question is just that it seems like we wanna deal with the ARPA funds as well, with the general funds and not.
Oh, we will, yeah. No, I didn't mean to, imply that, because the, it shouldn't matter who the funding
Sure.
source. And we need to look at all, so Dick, you have a question?
Well, I have a question about what the working bridges program is.
Well, that's the, new program, and it's something that, as I mentioned, it's in Laval County, United Way has started it.
United Way started a program in northwestern Vermont, and they want to move out to 2 other areas. Whale has been one of the ones that they've talked about.
But we didn't,
Right, we
put
talked
it,
about it last.
we talked about it last year and decided that we were not gonna take on, new programs and new demands. And so obviously the BAA is being used as another opportunity to revisit a budget decision.
I'm curious about the adult education, 500,000.
Well, we need to understand that more too, and
I to understand here, but
Well,
If we could ask our education committee to look at that.
Well, there is a new report added about that because we went through that a little bit last
I
year.
heard something from our, directed at Brian from our adult ed.
But what's really happening is the ed fund money is dropping off. And they're asking it to be picked up by the general fund. In that whole piece. So,
So I trade that for the corrections going back. to
Well,
the-
Well, good, we need to load a little bit more on the ed fund, by the way that's looking. So we're gonna have to,
No, it's,
I actually have gotten copies of the email of the memos that went from the policy committees back to health, and a lot of them, there's not, background in terms of describing what the need is, the urgency, why it should needs to be addressed in the BAA, what it does, et cetera. It's just, one was, Howard Center has requested funding for a cultural liaison person and what that person would do. It doesn't mean that might not be
now. But it's very good. It suggests to me that the way we do the BAA, where our policy committees are not sending in specific recommendations, make comments after the bill gets over, but we do make recommendations or make comments very much so when the big bill in the budget.
Absolutely.
Well, that's where I think it's much more critical. And then as the BAA comes over and there's been reappropriation and reallocation, then we can comment, but to put new things in, unless the timeline issue that you brought up or other issues are, time sensitive.
This is not this BAA is not where you start up new programs. It's where you move the money around.
Well, historically, but we seem to be moving away from that.
well, I actually would say, I think we're moving back into a time where we're doing exactly what we did for decades. For decades, the budget adjustment was always the place where you did the cleaning up. You didn't change policy and new policy was changed in your budget. And that all particularly got blown out of the water in the last 5 years with COVID. When, where we're doing 6-month budgets and, all of this, and it all got blown out of the water. And what the difficulty now is to get ourselves back into the same mode that we've done historically. And it's unfair to policy committees to be able to weigh in if you spend all the money in the budget adjustment and they can't think about where they might want to carry us.
Well, so I think we've sort of come to agreement that we wanna, make sure that we are, not, getting ahead of our priority setting process and making sure all, funding requests that are not emergency or not related to kind of that showing up with estimates for the expenditures, that the BAA is not the desired vehicle to do that.
Yeah.
And that's a helpful discussion, because I think that can guide what we want to do here and make it clear for anyone who's listening that if we in fact defer it, it doesn't mean that a decision is made. It's just everything has got to be stacked up against each other, when we get to the big bill. So send a star, then we can.
Yeah, that, what I'm gonna ask is not anything to do with this, but last night I think it was last night, it might have been the night before, on the news, they had where one of the motel keepers, they settled, with the attorney general on.
Oh, on the
deposits.
deposits. That's
Well,
right.
the way the story was reported, the deposits were gonna be returned to the individual.
That's right, they have to be under the federal rules.
Right.
They have to be under the federal rules. That's something during fiscal, remember, we talked about that.
Yeah, but we must have paid the
The federal,
deposit.
but it's federal funds, and those federal funds, I think we had a discussion around that. the benefit went to the individual and therefore the deposit was returned to the individual. We did have quite a bit of clarification on that in joint fiscal.
So when these individuals get this check, I mean, as much as $3,500, that should free them up if they're still in public housing, so that they'd have enough money to get their own housing with an ample deposit and double dipping, we've always been.
Well, if they got their deposit back, they I would assume have left the hotel and must be in other housing at this point, but I don't know. We can get a restatement on that. I do know it was a topic of testimony at joint fiscal.
It's like $3 or $4 million.
Yeah, it was.
Yeah, it's a sizable sum, but I think one of those odd things in federal funding laws that we have to deal with. I know there's some that go the other way too. That, what they can claw back from us. Right, claw back.
Yeah, so, but yes, we did see that. And we could, Emily, if we can get some kind of statement on that, or look at what we got from joint fiscal. But and we did talk about that. So, the question I have for the committee, and you've got a question.
Well, I was thinking to ask you about that. The third document that we had on the BAA. I didn't really know how to read that document. Like what,
Which document?
the one that has the unduplicated and duplicate columns. It's this one and the full fold out one.
Oh, the folder.
This one. I got, just from my experience on the committee, I don't know what it means when they're talking about unduplicated and duplicated. You sound supposed to.
That's, that generally is probably global commitment. Because what happens is you appropriate to the Agency of Human Services
Oh, right.
and you get a drawdown, it converts it into global commitment, and then that is then appropriated both the federal match and the state dollars to the departments. Yeah, so
You don't
Dale,
double count it.
no, so that is, don't want to count it,
Right.
but it's how we leverage the federal dollars. And so that would be related to the global commitment budgeting and what appears at the agency level, and then the funding that is appropriated to individual programs. Most of it's DEBA, but a lot goes to Dale, mental health, so forth.
The other, if I can, the other duplicated appropriations are interdepartmental transfers are appropriated twice. The internal service funds are appropriated twice. And global commitment is the big one, but those are sort of the three big pieces that we appropriate more than once.
Okay.
So my question is, in the remaining half hour, do we want to return to this spreadsheet and see if we can close out some of the human services? And if we don't want to close them out, who do we want to have come in so that we can schedule them to get more testimonies? Take it from there.
That's the original
It's
26 page.
Yes, it's long spreadsheet here. Yeah,
Gotta find it in the.
Yeah.
I think I folded it.
Got
No, I don't have it.
Just a second.
no words. Yes, right here. Yep.
It's a 5-page document.
Okay.
There you go. Find it.
Your screen might not carry all columns, but
Yeah, I had looked at it.
so, I don't know, Emily, if you wanna walk us through this or, Andy. But Human Services Secretary's Office General Fund, obviously, that's general fund is drawing down the federal funds. And the purpose is, the waiver, 1150 waiver evaluation contract, which we have to do, obviously, under the waiver. And then the technical assistance contract. And I gather the House included that. And do we have any questions on that, or do we want to hear more testimony? think this is all related to our, 11 waiver and, model, so we can close that. I think that's really more, obviously more administrative requirements than, benefit, but it's part of our operation. And then the big one, of course, is, the next one down, and that's global commitment, but that is going out to a variety of departments. Over to the right, you can see where it's going to CHIP, to graduate medical education. Dr. Dinosaur premium adjustments, and that was to keep those premiums from going up, from keeping them at no, I think it was to continue, not charging a premium.
I'm not sure on that.
Do we want to have more testimony on that? Or just more explanation? Anyway, premium adjustments. Caseload utilization is a big one, and that's usually straightforward. It's just based on actual experience. Then, so there are a lot of moving pieces that get us to that big, it's a very big total. As you can see, almost 40 million of federal funds that are being leveraged through global commitment for a total of 48 million. So do we want to hold that for now? Okay.
I would hold it until you approve for all of the global commitment changes.
All right.
And then we'll close that one last as.
Because obviously,
Reconcile.
so I'm gonna hold that, health access.
I haven't heard on
Oh my gosh, data warehouse, and this is the data lake and all that.
They're doing so much work.
They are doing a lot of work, but this is,
This is B 307.
yes, it's BO 306, was the administration. It's a down. So,
the other day when we ran through this, I put a hold on that, for some reason.
we didn't get through, we didn't even talk about this section at all.
Also, you just.
Yeah, everything was held, we're just
So
dealing with it now.
Well,
Yeah, we
It
held
doesn't look like, technical adjustments of postal service contracts.
yeah, and it's a down.
Yeah.
There are a lot of contracts within DEVA. So this is a down. Are we gonna spend a lot of time on a reduction?
No.
We'll focus that. And now we're back into health access. And these are, sorry.
But caseload reduction.
Updated caseload and utilization estimates, Brattleboro retreat. And then we had federally acquired hospice rates. That's some supplies.
What's any,
Is that any on medical?
And why would the Brattleboro retreat be state only?
Because I think we can get, the limits on the Medicaid match with a psychiatric, institution.
So that's a match deal with it.
Well, there are limitations on what you can do for inpatient, all right, wait a minute, I found it here. We can go back through, and this is the best description of all the DEVA related changes, so, and Stephanie came in on this, and we've gone through all of the program, annual buy-in changes. Which we have to do. Let me see, what was the one, MEI?
Yeah,
MEI,
for FQHCs. 4.5% for FQHCs grants. And
oh, maybe related to Medicare. Yeah. Yes, that's number 10, and the funding is to increase the payments to FQHCs by the Medicare Economic Index. That's MEI, which is a measure of practice cost inflation that Vermont applies to FQHCs and RACs. So that is, using, to
Turn
increase the
that light
payment by
on if
the
you don't
NEI.
mind.
Right.
Just see the small print. Thank you.
All right, and then the Brattleboro retreat, I mean, this is all in here, I don't need to read it to you, but,
No.
it's all, outlined why, we can go back through, but, yes, continuous enrollment of children, so.
They
we
got
don't-
more people than
Yeah.
they expected in a different.
Yeah.
They weren't, the guy from Brattleboro Tree explained it to me. It seemed logical to me.
It's the patient mix,
Patient mix.
is that what you're seeking?
Yes.
Yeah.
Obviously,
So when a person, at the retreat, and this gets this, Senator Starr's question, is that, it's related to the length of stay. And, after, and for patients staying longer than the 60 days, they fall under the IMD, which is Institute of Medical Disease Restriction, and are not eligible for Medicaid. So that's what we're doing here.
so that's part of the problem everywhere. So hospitals,
Well, no, there's special rules about, with IMDs. That's why we can't get the Medicaid match for the psychiatric hospital. Remember that?
right?
Yeah, so,
So
and it's more that 16 beds.
I would say about the FQHCs, you know, the FQHCs are in real trouble.
Okay.
And, I think in overall, it really is an issue that our health and welfare should, take some testimony on to get there, because they are having issues, but, and I know it.
We can do that very, for the budget discussion.
Also, I remind the committee that we do have a report that was produced by Viva, around if you move to a cost-based reimbursement for FQHCs, how many millions of dollars that would require.
Yeah.
That was, I think, probably asked by the House. And this committee increased the reimbursement by 10% to FQHCs last year. And which was more than the House had done it. But there is a report out, and I would probably, maybe help him also take a look at that. We also need to get from, and maybe Amy or Emily, the FQHCs assert that our reimbursement methodology for FQHCs is contrary to federal law. DEVA folks, when we met with them, said they disagree with that assertion, that the methodology is not contrary to federal law. And so
Lawyer to lawyer.
so we need to get a statement or some communication from DEVA and the agency on their position that that the reimbursement methodology. Somehow if we went to cost-based reimbursement, the methodology doesn't, that makes the issue go away. I guess maybe more money makes the issue
Well,
go away.
that, I think cost-based reimbursement would mean more money. I think in the overall, it is gonna take sorting out for that, because so many of our primary care doctors now work for our FQHCs.
Won't?
Will,
They do.
they do, and,
Oh, yeah, they,
and so it's an important issue for, to be sorted out.
Or they work for hospitals.
so, but that's a longer term issue, and a very expensive one.
In different case, different is the FQH, the hospital is the FQHC in Randolph, so.
My recollection, when Stephanie was in here, we went through all of it and people had a chance for questions. And I don't think
Yeah.
there was
fine.
anything that was not
Budget adjustment,
that wasn't
But-
really appropriate for the budget adjustment.
right, it's an issue,
Yeah,
the reimbursement and trying to go back and primary doctors is huge. But
So
like I said, my.
307,
Right.
So my own who's independent and is retired.
well, I'm telling you, the independent docs, that they are, in fact, they don't have the other federal provisions and they come with FQHC,
We
so.
do this separately.
Yeah, he only saved money.
We did that.
You know,
What's that?
Well, what's that?
Right, what's that?
If you departed quickly, you might save us money.
That might have,
Huh?
Yeah.
That's my, I
for
think
sure.
we should tout the law, live healthy and depart
Remember
quickly.
Howard Dean talking about all those old,
Yeah,
how much money they cost.
I know, and now we are one.
And now I are one.
I'm gonna go to 309 on that note. This is Medicaid only. And, this is buy-in and, well, family planning investment, that's a transfer. And then, just a variety of, state only, costs. So,
There's a clawback update estimate.
well, don't you remember when they
You're gonna put
passed?
that in there, but you know, we're estimating something that we've got at 655. Usually when you estimate, you're not, that's the only question I have. It seems pretty
Yeah,
like
that's,
a definite figure, not an estimate.
well, Part D, when they passed it in Medicare, had that clawback.
No, I know.
So here's the,
It's unusual to see an exact number like that.
Well, if you want to know more about all of this, if all you, this document is
yeah,
really.
that's the transfer. So that's good.
This is when the FEMA came in and, that's where most of your.
Phil sat down and wrote that.
So some of the money that is the, Brattleboro retreat.
Yeah.
Money coming in,
Um,
the state.
Got it. Just.
No, that's the patient.
I'm listening. Sure.
so, on, 310. General fund went down, federal funds went up, and, so that here's your buy-in updated estimate. So I think that's just, pretty technical adjustments. Public health and, on family planning,
On Diva generally.
okay,
So I missed when you did Goldman, but one thing just to note, and we can close it, approve it, whatever separately, is the House did add funding for the VNAs to bring them up to the Medicare LUPA rate. Don't ask me the details on the LUPA rate, but that was one thing that the House did change related to DIVA, and it was to put the rates will go to start the rates on January 1, I believe. Or no, I don't know what date the rates would start, but it was a request from the VNA that they funded.
well, I know what,
But it wanted to
what list would you put that on? Would that should have gone on the side by side, should have done.
It was a base change, so it wouldn't be a one-time thing. I have a side by side, they only made 2 changes to the base.
Okay.
That I gave you.
All right, well, we'll consider that as part of.
As a separate thing, but just wanted to note that there may be a change in that section. You could approve all what the governor recommended, and then we can discuss the House parts separately if that were.
Yeah, okay. Public health,
Yeah, can I-
vaccine purchases.
yeah, can I ask about that?
Sure,
The vaccine purchase, I assume that's. Like I get Medicare, so I got a free vaccine this fall. That's not true for Vermont. Who are we buying the vaccines?
for children, we do all their, 5-year
Children
vaccine.
mainly?
Yeah,
And what about the testing kits? The other night, Eric we were concerned that Eric might have COVID. So Brian went on, how he does these things. Had the kits delivered from Walgreens by DoorDash in Bennington. Cost him $125 for 6 kits.
Oh, yeah.
I mean, we're getting to a point where the testing kits
Yeah.
are gonna be so expensive that the average Vermonter won't be able to afford them.
I bought some.
but there's something you can get free.
Yeah.
Well, you can
Better
pay
than
the
ours.
federal government.
Yeah.
You
Yeah,
can,
well,
My library
I got
gets
mine
not
from-
free.
Yeah,
Walgreens, free ones.
I got you said,
maybe DoorDash.
I got two of.
yeah.
I don't know.
You showed me your
Free
insurance
except for
card.
the-
Oh, I don't know. I think there was a charge, because somebody else told me they had to pay an exorbitant rate for.
Well, they do
testing.
sell them, I know that at
Yeah,
the drugstore.
But in fact, I was just there the other night. And I didn't get the kits, but while I was getting what I was getting, person came in and they said, we're all out of the free kits. But we have some that are, so it might be what is,
It is
supply
a
chain
supply
issue
chain. It is a-
for the free.
Before we approve all this, I'd like somebody to get back to us from the administration on what we're doing, because I would hate to see people who are feeling that they may or may not be positive, not get the test because of the expense.
But these are
And then
vaccines.
expose other, I realize it's vaccines,
Okay,
but, and I'm all for that.
Okay.
But I'm also thinking that we should have
Yes.
testing ability, particularly for lower income folks
Well, I've
who
got
may
some
not
by
wanna
Medicaid.
pay at Walgreens.
Maybe we can get something
So
from
under
public health in
Medicaid,
terms of, I imagine they would be under, if you're a Medicaid beneficiary, but,
Well,
but these
and there
are.
all I know
are
is
free,
what
there are
happened the
free
other night.
kits out there.
Huh?
Yeah, you can order.
Well, I got
Yeah,
2
so-
free kits from here in the State House.
Yeah,
And my library has,
Been a lot cheaper
Yeah,
to drive
places
down.
have.
With Brian's money.
You know, that,
Ryan had got,
Money's no object to Brian.
please.
I have a valet DoorDash. Oh, Brian,
Yeah,
these, I believe, are mainly children's vaccines, and so
Okay.
they're free, but they,
Well, let's-
cost to administer them.
Yeah, I want to get the
Okay.
information about the testing.
All right.
It seems like that's gone by the wayside,
It's just a thought,
and the
so
more
we'll see if we
difficult it
can
is
find
to
out.
test, the more likely it is we're going to have outbreaks.
Okay, now we're down to mental health. And they're asking for 2.5. A lot of it's local commitment, but there's almost $1 million general fund. So a lot of it is associated with their psychiatric hospital. They had to hire contract nurses and then they did have some savings on PNMI and then the mobile crisis,
I
which,
wonder who tax got the word in that fee, and I'm thinking,
is that for the one in Berkshire?
Keep moving after keeping
ever, yeah.
Is that up in?
I'm
In the hospital?
I'm thinking that what you had was they PNMI something that was, in getting the Medicaid match, and that's where the savings came.
People.
So I think none of us had any of the commissioner Hobbs when she was.
I don't have a problem. And it just, I think what happened was PNMI changed it, the feds changed some of the rules on what they would cover under PNMI.
And so they could leverage more Medicaid dollars.
Actually, less, I believe, food was taken out from some of
Oh,
it.
that, but this actually is, a reduction
Right,
Yeah,
of state dollars, not adding more.
right, I understand.
So, but yes, you're right, they did, make some changes in terms of what's allowable. All right, we're down to 316 DCF. And this is, and most of this is the housing call center. To give a level of service so that people could get through.
Do the same thing for
Yeah.
personal labor.
I know.
They got past the 250.
People who are unemployed now, they don't have housing because they can't get through the Department of Labor to get their benefits.
So I think,
Is it to increase capacity or just continue the current?
no, they had very long wait lines. Remember the commissioner testified, people trying to get through on for emergency housing. And, they brought in a contractor and they reduced, what's it, 40 minutes and, I don't know, I think it was something much more acceptable. I don't.
Yeah,
remember.
the people calling labor would love it 40 minutes away.
What'd you get? We're not answering the phone.
Yeah. Call back later.
We're not answering the phone.
I'm not qualified.
I get that she would have loved that. She was telling me she was on the phone for 2 or 3 hours.
And that's if they answer the phone,
Same thing.
put you on a.
Well, do you
Yes.
remember, when we had the exchange, And remember,
Oh, that-
somebody had, you
remember
know, the
that?
man was like slitting his, they had that filmed on YouTube, and I was on hold and he was slitting his wrist. It was a lot of clever.
Yeah.
All right, now we're down to 317. And this is targeted case management, that's technical. This random moment time study matrix, so that sounds to me like a time study and, cost allocation. Temporary assistance of family state plan adjustment. Do you remember what that is?
But it looks like it's balanced.
Yeah, it does.
So it looks like you
Like one is
balance,
up and one is down.
right,
It says net neutral, yeah.
so
Yeah, all right, care, substitute care caseload.
That's
Is
all.
that- yeah, it's all, and then, exclusive of PNMI changes.
Well, the whole thing is a mess because of the COVID, no,
Yeah,
yeah.
uh-huh.
and the
And,
lack of a, long-term care, lack of a placement for difficult to place kids.
so, normally you work with TANF, is that something that you have any thoughts? It seems to be pretty straightforward, I don't remember we have any.
Seems
Child development, preschool development.
Well, they
plan.
take us 5,000,
Given the option.
child abuse prevention reductions.
Community, because it's community based.
Community-based child abuse prevention reduction, 25. That's
Grants.
3.8 million preschool.
Is the preschool development, is that part of our childcare, bill where we were doing capacity? That's different.
It's additional
Yeah.
federal funds that came through.
Yeah,
It's all federal. Well, I think we wanted to give them the spending authority and, take advantage of that. Personal needs, ages blind and disabled, Sunday. This is what we,
Oh, there's the TANF money.
age of blind and disabled is personal needs increase. Are we really talking about the state stuff?
I'm not sure, I'm not there, ups and downs has it as as a net neutral, so there's a. Someone's got the down and that's up, but I'm not sure where the other side of this.
Global commitment.
It's global commitment. When we increase the state supplement to the federal SSI benefit, the state stuff is called AABD. And we did that a couple of years ago, and, we global commit, that's an eligible, I think it's probably an MCO investment under our waiver. And we get a match, that it's not all, the state supplement is, combination of federal state under global commitments. I'm just thinking that, it's net neutral, so it must be taken off somewhere else. Anyway, it doesn't look like, it looks like they're, it's global commitment funding and it's for, but we don't call the state sub personal needs, so that's what's confusing me. I don't know. Personal needs and incidentals. We can find out the answer. It's federal dollars and it's, people really wanna. I'll see if I can find out a second more about that, because, I expect it's the state supplement to the federal SSI.
You invented that.
I did not, I was responsible for getting that
Yeah.
increase,
Yeah.
after 2 decades.
Yes.
Yes, I went next
Couple of years
door
ago,
and
yeah.
said, you know, it's nice to give these tax reductions, but look at all these areas where we're not doing very well, and so it was the first
Yeah, I
time
remember that.
we had a tax bill that actually carried an appropriation. It was a new high.
The first one.
Most people didn't know, well, it's just the state sub for everything. It's the state sub to the FFLS5.
Yeah, you wanna buy a stamp, you're in a nursing home.
That's different. That's the personal needs allowance.
I know.
Yeah.
Oh, that's a different.
Oh.
This is different. The personal needs allowance is the amount of money that you're able to retain, before you have to turn the
Oh,
rest over
okay.
to
Yeah,
the
yeah.
nursing home.
Yeah, okay, right, yeah,
And that,
But we did do that too.
yeah.
that is still.
Well, I didn't deal with nursing homes, but.
Okay, I'm gonna go to reach up and this is, look like maybe we're,
What number?
On this next page, 323,
is this where the 725? No.
up 991 and down 725.
Yeah.
Well, it looks like we global committed something and
Yeah.
freed up.
Right, and
state
take it on the
dollars.
other page.
Mhm. So I think it's, that's just, leveraging your, federal dollars,
Yep.
except federal funds. Well, probably the federal funds. All the commitment money.
Well, the temporary assistance we got,
Yeah, that's,
the rest of it looks like the leverage federal funds at this moment.
do you know if the reach up caseload, how it's looking relative to estimates?
We can find out.
Okay, I think that's what we're struggling with. Maybe we could, we're almost. We've already closed out 338, and we've also closed out the Vermont Vets Home, so we really only have 334.1.
Yeah.
And, we can run through that, it's all global commitment. Choices for care carry forward, 5% increase in, these are the providers, the increases that got left out, and I think everybody supported that. And then of course, the emergency relief for nursing homes.
Yeah, and they
On
need,
that one,
Huh?
the emergency release for nursing homes, the House reduced that from 17 million total to 14 million total based on their conversations.
Uh-huh,
So it might be worth having,
okay,
and then they booked the general fund savings. in
and
their
spend it
construct.
somewhere else. I guess we ought to have the testimony from the agency on that. The nursing homes are in pitiful shape.
So what was the difference between, do you know what the difference is between what the House did and what the administration?
They did, instead of 17 million, they did 14 million.
Yeah,
The
but what
question
does
is,
that
what's the
mean?
basis?
Oh, what does that mean?
In other words, why did they come up with a different amount? Was there, a revision? Was there something?
I know that, and we can send you the link too. I know that House Human Services and House Healthcare took testimony on it and then recommended a change. But you don't know. if
Cause that's a big difference.
All right, so, and will we put down, we want Dale to come back in? Yep.
they didn't put that on their little,
No. No,
behind it.
well, they probably put in that they increased in, funding for nursing homes, just not at the level that Governor was requesting.
So we're gonna hold that.
Yeah, we'll hold and have the Dale folks come in and explain that.
My nursing home is.
You're
having
absolutely
beds in
right,
my house.
Senators.
They're backing up in my
Funds
house.
Dale Emergency Financial Relief for Skilled Nursing Facilities, 14 million for global commitment.
So they put in,
They didn't mention that
That
they
they-
took 3 million off the governor's.
and maybe there's a legitimate reason for it, but it would be nice if we understood the rationale.
Yep.
Thank you. So it is 2 minutes of 2, and we are through, the only thing left was, which we closed out Justice Reinvestment 2, we closed that out earlier, yeah.
Yeah, there was some misgivings or some misunderstanding about that some places, but that's what the justice.
So this calls out veterans home.
Yeah, we're all done with that. We approved that yesterday.
Oh, we did it, okay.
So we are through human services and now we're just really at the end. And so we'll have, the Dale Commissioner come in and talk about the nursing home, change. We will have, Anthea Dexter Cooper come in and talk to us about the language on the Vermont Strong license plates.
We have a question on,
Debt
Southern
service.
Tam
What's
the
that?
other day. Way down at the bottom, environmental.
Air and waste.
Air and waste management.
Yeah. We're not gonna hold that.
Yeah.
We wanted confirmation that that by taking the money from, waste management, that it didn't have a detrimental impact, on the fund.
So we're still.
The House Natural Resources Committee did look at that, and they just said they were concerned, but they didn't oppose it. So, and the secretary seemed to feel that they could make the change and wouldn't have a detrimental impact. Because we asked her.
And maybe this is for the fiscal year, with the big bill, but the Department of Labor problems with their phone system. I mean, why are we getting a new contract to get the call weights down for emergency housing, but we don't seem to care about the Department of Labor's problems? Not we, but we just care. I know you care.
Ask the administration.
You're right. I guess
I
that's-
think not, I think we have to direct it.
Why doesn't the House care?
Yeah, I don't know. That's my question.
Maybe employment, issues of.
Probably because individual claimants don't have a lobbyist to come in and plead their case. That's why we have to do it.
Yeah.
I think we can make an inquiry. If we could, just, an email, not an email, but a memo, from the committee inquiring, what remedial action is underway to address the long delays in, taking calls for the, UI system. We can,
I don't think so. I got a call yesterday.
Oh, okay.
so
I haven't gotten a call recently, that's why.
So we can, send out an email on behalf of the, a memo, which will go by email. Asking them to brief us in terms of what actions are underway or being contemplated to address the unacceptable, delays in answering the phone at, for claimants, for UI claimants.
I do it at home, so I don't think I should criticize them.
You do what, put people on the long delays when they call you?
Yes. As a matter of fact,
You answer the phone, say, I'm not answering the phone right now, call back later.
some senator gave out my cell phone number and I know how to block callers, so I blocked the call.
Well, we seem to be getting off the BAA and I think people ready to call it a day.
I am.
Ready to call it a week.
So I'd asked Lisa Gavin yesterday, who was here, if she could give an update about the work for DOL, and she did provide me a little bit of information, so it may be, I think the memo is one. a good
It doesn't have to do with the IT system per
Okay.
se, this has to do with the
But
folks
no.
that can't even, does she talk about the?
No, I recognize that asking that question is really important, but they are working on something, so I just didn't know if you wanted to have her, then you could possibly do that as well.
Oh, okay.
Cut that through the whole system as well.
Yes, they have $35 million in modernization project.
Oh, can I grab
So-
Which is already budgeted.
Yeah.
Budget adjustment.
But I.
But it may or may not, that's you with the phones.
Right.
Yes, no, it's good to hear.
It's a replacement for that.
Yeah, it's if we start putting money.
We've done this.
Yeah, I think
And I
it's something
think
that's federal.
that,
So we're gonna go off